My name is Don Bradley. I'm a family physician by training and demeanor. I have practiced in a rural setting. I've taught in an academic medical center. But over the last 26 years, I've worked for Blue Cross Blue Shield as their Senior Vice President for Healthcare and their Chief Medical Officer. The Practical Playbook from an educator's perspective offers a wide variety of resources. Probably most importantly, so the Practical Playbook is about integration of primary care and public health, which is a key component of population health. But I think it helps to define the field far better than what I think most people understand. So the story I like to tell about that is when I first returned to Duke, I was walking in with one of the former chairs of my department, who was an MD, MPH. And he said, "Well, what are you doing?" And I said, "Well, I work with the Practical Playbook, and I do a lot around population health." And he said, "You know, I have an MPH, but I haven't a clue what population health is." And I think that's actually more emblematic of where people are in terms of population health than I'd like to think. The health system is aiming towards population health with the healthcare transformation, but there are a lot of folks who just don't understand what that means, and not just students in an MPH or an MD or RN course, but people who are out there in the workaday world or people who are in the medical center. So I think it's a real opportunity to, one, define what population health is. The other thing that it has in it is a real framework and a model for, how does that work? What are the stages? And it moves from just, what is population health or what is integration to how do you do it? And I think folks really kind of understand that better when they can really begin to apply it a bit more. The other thing that the Practical Playbook does is it serves as kind of a super node, or a place that both teachers and students can go to look for other resources that would be available. One of the key resources in the Practical Playbook are case studies, or success stories is what they're called in the Practical Playbook, and they provide a number of both geographic and varying conditions and actually even partners on how to solve a population health issue. And it's a great place to start a conversation in a classroom of, what went well, what didn't go so well, what else could we have done, how does that apply to the project that you're working on. So the way I use the Practical Playbook is particularly in the context of a flipped classroom, where really what I'm doing is asking students to learn a lot of the content prior to coming to class, and then we can have a discussion. So I call it, rather than my regurgitating information, we're actually applying information. I think that's a lot more effective in what we need to do about learning exactly what it is that population health is, and particularly the integration piece of it. The other use of the Practical Playbook in education is really a place to help people dig deeper. So we may start with a case study or a success story and say, okay, what happened that went well? What didn't go so well? How would you do that differently? How would you compare it to what you're doing in your project for your classroom piece? So I think it provides other places, and for those who are particularly interested, a deeper resource for them to get into. So the students' response to the Practical Playbook has actually been incredibly positive, really for a couple of reasons. One is it helps me as an educator to move to more of a what I call a flipped classroom, where I'm asking the students to really learn a lot of the content before they get into the classroom. So their role, the student's role, is not in the classroom to regurgitate information, it's to apply it. And they certainly like that. If they're talking and they're thinking through it, not only is it more fun for them, but the retention tends to be better. It also avoids them having to listen to me drone on for 50 minutes in a classroom. The second thing that it really does that I think students like, and it is kind of a stealth way of teaching team-based learning and team function. So because we're applying information, different students will have different views of how that case study worked or what that framework meant, and they can begin to discuss and also then to understand what their different strengths and weaknesses are and how together they can really solve a problem better than if they're just regurgitating it and working on it themselves.